The spread of coronavirus has many concerned about what that means for Australians. Joining us live now is Nigel McMillan, Infectious Diseases Program Director at Griffith University. Nigel, thank you for your time. What is your concern with the declaration of coronavirus as a pandemic in Australia and what that means for ordinary Australians worried about catching the disease?
Well, I think that the main concern really is our most vulnerable population. So these are our elderly. It's pretty clear from overseas data that the fatality rate for those over the age of 70 is much, much higher. And curiously, for those under the age of 9, there seems to be no fatalities, in fact very little infection. So all the measures that we need to put in place are really around protecting those most vulnerable in our society. And you can see now the government is now stepping up their preparations and the seriousness of how we're taking this pandemic to a new level, and we'll just keep racking it up, I guess, as the virus slowly starts to invade the country.
How significant is it that we've had the first human-to-human transmission of coronavirus in Australia?
Probably not surprising, but it's a significant next step. So, in some ways this is a bit like the bushfires. We're going to have embers coming from the raging fire overseas, and the question is it going to really catch, and we're going to get widespread local transmission, or are we going to be able to control it? You've seen a number of models out there that suggest that 20 to 70% of Australians might get this over some period of time, but these models are pretty loose and inaccurate at the moment, and they really don't take into account the sorts of things we're going to be doing to counteract the spread of this virus, such as home isolation. But we can look at Italy, for example, to see what sort of things might happen. And, in the Italian cases, about half the people are isolated at home, while another 40% are hospitalised, and the other 10% go to ICU. So we realise this is going to be a significant burden on our healthcare system, and the planning is well in place to deal with that.
We have seen a lot of people panic buying supplies, hoarding up things like toilet paper, painkillers. Do you think that people are overreacting, or is this a good thing to prepare for?
Well, I think we need to be prepared without panicking. I'd like to think that most Australian households hopefully have a couple of weeks' food supply generally anyways, just as a matter of course. I mean, it may not be your favourite food by the end of 2 weeks. And of course the other thing is, we live now in an internet age when we didn't have this in our last pandemic in 1968. So we can have home delivery and order food in. But it just makes sense to have that sort of supply. If you're going to be isolated in your house for 2 weeks, go and buy with your regular groceries. Just add a few extra things if you think you don't have 2 weeks supply. But no need to panic buy.
When it comes to the actual symptoms, the experience of coronavirus, for younger people, is it more likely to be like a common cold?
So experience overseas, once again, where most of the cases are, tells it that most people under the age of 65 or so will have a fairly unremarkable illness, something around 4 days. It'll be like a common cold, somewhere between that and a flu. We can clearly see that it's really those older patients who have these comorbidities, poor heart function or lung function or the like, that really seem to be the most susceptible. So we really want to make an effort to make sure that we're keeping this out of our old aged care homes and places like that, because if it got into places like that, we'd have some serious problems.
If someone does suspect that they might have coronavirus, they might feel a bit silly making a bit of a fuss over what could just be a cold. What point should people say, I need to put my hand up and say I might have something I'm worried about?
Well, I've been telling my staff at my workplace, if you have a flu or a cold, stay home, and I don't want to see you back until you're better. And I think this is just how we should deal with it anyway. If you've travelled from anywhere and you come up with symptoms that are a bit like a cold, you should go and be tested. And it's not a fuss, it's something we do. I know in Queensland we've tested around 3,000 people now in this manner, and none of them have come up positive, so that's great. So if you've travelled, that's really important that you do that. But as time goes on and this virus starts spreading around, it's just a matter of course that you should be tested, and we need to isolate you. We don't want you out in the community spreading this around. Our best course of action is this home isolation. So you're going to get a couple of weeks at home and catch up on all your Netflix and work from home perhaps, but that's really going to stop people spreading it.
Sounds pretty good to me. Just finally, one of the big questions, does wearing a face mask do anything?
No. So face masks are fairly useless. For someone who actually has an infection, it generally stops them coughing out, water droplets that contain the virus. It contains them. But if you're actually at that stage, you should be at home in isolation anyway and not be out and about wearing and needing to wear a face mask. Face masks can also stop you touching your own mouth and nose to some degree, which is how we mostly infect ourselves, but it's not going to stop you breathing in a virus. I came through Brisbane Airport yesterday from an international trip and saw face masks in some of the staff and biosecurity staff. And look, if that makes them feel better, that's fine. But as an infectious diseases expert, I can tell you it's not very effective.
Well, there you go. I was getting in a lot of trouble for not wearing one going through Hong Kong a few weeks ago, so now I feel better. And can I ask, what is the best way to prevent the spread of coronavirus?
So I think it's important that everyone in the community takes responsibility for their health and making sure that they do isolate themselves as soon as they have those symptoms and go and get themselves tested. Ring ahead to your GP or to the emergency room or the fever clinics as they're now set up in Queensland, and make sure that we don't allow this thing to spread around. We can see with Iran, for example, they clearly had no idea that this virus was spreading around left, right and centre, and now they've seeded that virus from Iran to all corners of the globe, including New Zealand and Australia. And this is what happens when you don't keep track of things and you don't have a good public health system. So we can limit the spread of this and make it a really slow burn so that the spread of this virus is as limited as much as possible just by doing that. And also simple personal hygiene measures, and I know your listeners are probably sick of hearing about washing hands, but it really is our most effective means of doing things. Alcohol gels work well against this virus, and coughing etiquette. And then there's social distancing. And so that means, not getting in someone's face, keeping at least a metre away. There's the handshake that's been suggested we don't do anymore. My attitude towards that is, choose your own risk. If you see someone coughing their hand, I wouldn't shake their hand straight after that, for sure. But, it's up to each individual if they want to not shake someone's hand, and I don't think it would be insulting not to do so at this stage.
No, and I always love a pat on the back, so maybe it's not a bad way to approach life. Nigel McMillan, thank you so much for your time and your insight on coronavirus.
Thank you.